Hi guys, it is Kiara. I am back with another video. So as you can see, I have on my white coat, I have on my fig scrubs. I am currently in the car. It is currently 7 o'clock in the morning, and today is my last day of my second rotation. So if you have seen some of my videos before, yes, well, if you have not seen some of my videos, I am a pharmacy student in pharmacy school in a 4-year program. This is the last year, and the last year of your program, you are to go on rotations, and every 6 weeks it changes to do a different specialty of pharmacy. And so I did my first rotation. Today is the last day of my second rotation, and they're all different. So my first one was the pharmaceutical company. The second one here is institutional pharmacy. And so that's what I was doing over the past 6 weeks. Honestly, it was not too much to record. I'm not in love with the location that I am at. I'm not gonna lie, sometimes they did have me doing some busy work. Sometimes I didn't feel like it was as meaningful. I did work on a few projects that seemed like they were meaningful, but every day, I wouldn't say every day was something different. Every week it was kind of something different. So let me just walk you guys through the steps of like what I did over the past 6 weeks. So the very first week, it's institutional. So it's inpatient for the patients who are inside of the hospital, depending on what they're in the hospital for, whether it's psychiatric needs or high blood pressure or the glucose or glycemic control, or COPD, having problems with breathing. Whatever they're in the hospital for, in the inpatient, we get cassettes together. So while they're in the hospital, there's certain medications that you're supposed to get on a daily basis. So I was filling the cassettes, and to me, it was like kind of busy work. But it was cool to see the different medications, kind of get familiar with the brand names and the generic names. The second week, I did IVs. So that was really cool because we learned how to be in a clean room and the septic technique in school. And so to actually do it in a real setting, so cool. I actually enjoyed that. I like that. And then I was doing a project as the hospital is about to start a new type of system. So I was doing a lot of coding and mnemonic, more so like computer type stuff for 2 weeks. After that, I was asked to do some projects. So projects such as, there were 2 projects for investigation. So there was a patient who came into the hospital for something that has nothing to do with diabetes and their glucose. Although they do have diabetes type 2, that's not the reason they came into the hospital. But while they were in the hospital, their glucose, it shot up high on many different accounts. And so the investigation was to kind of see if the patient was getting a sliding scale insulin. So when we see an elevated amount of glucose, did the nurse give the patient insulin? And so there were different accounts where the patient's glucose was extremely high, but the nurse didn't give the insulin. Alarming, right? There was another case of a patient who came in for a totally different reason, but their blood pressure kept rising. They came into the hospital with a very high blood pressure of like 190 over, I can't remember. If it's that high, we should be giving something. The hospital didn't give anything. Another alarm. Over time, they were in the hospital for, I think, a good 5 days. 2 days, high blood pressure, not given any medications. When it's time for the patient to leave, they were finally given nifedipine and metoprolol. But why did it take so long for the patient to finally get the blood pressure medication? So things like that, like I liked it. There were cool projects where I got to investigate, and I kind of got to see like, well, why isn't this patient getting the medication they're supposed to be getting to control their glucose or to control their blood pressure? So I really like that. Another project that I worked on, the hospital does medication reconciliation. And so I did that way during my APPE rotation, where pretty much we work up the patient in the morning, there's a list of the medications built through their insurance of what they are accustomed to getting. So we go to the patient's room who are just admitted into the hospital. We ask them questions of if they're currently taking these medications, if they're familiar with the medication, if they have any side effects with the medications, if they are adherent with the medications. From that list, we will go ahead and confirm that with the home pharmacy to see if they have picked up these prescriptions, just to really see, you know, if the patient is on them, if they're not on them. Do the patient even know what we're talking about? Do they even know what they're on? Half the time they don't know. And so with that, we'll take that information, we'll input it into the computer system, and then that way the doctors and the inpatient clinical pharmacists, they have this information. So going forward, while that patient is here in the hospital, for whatever reason that they're here, we can still treat and give them medications that they're normally used to. We do not want to give a patient something that they're allergic to. We don't want to give the patient something that they're no longer taking or they no longer need. So things like that, we do a medication reconciliation. So part of my project, it wasn't to do the medication reconciliation because I've done that before, but we want to see, after doing the medication reconciliation, are the doctors giving the patients those medications specifically? And so I've done it for a whole week, and I noticed that we've put this list together of the home meds that the patient is taking. The doctors are not inputting it. Why is that? It makes me mad because we hear so much about doctors, but I don't think that pharmacists are respected in this industry, and it's frustrating because we know about the medication the best. I spent 4 years for this. So that was another project that I did, but I've enjoyed myself. My preceptor gave me time to study for my NAPLEX. I'm not gonna say it was super chill. Like, I did the work that I did. It was very meaningful. I feel like I could have done a lot more, but I'm okay with the things that I've done. I've learned some things, I will say. And so this is not going to be a long vlog because I'm not going to show too much or do too much because I'm not supposed to even be doing that. But I kind of just want to show you guys, well, tell you guys exactly what I've done over the past 6 weeks, but actually show you what the pharmacy looks like. I think I'm going to do a few IVs today. I think I'm going to do one last project today with the medication reconciliation. Kind of show you how my day goes. I don't start from the very beginning of washing up and doing all of that. Y'all don't need to see all that. This is about pharmacy related stuff. This is how my day goes. I am late. That is the last day, so we're gonna bypass that. But I'll show you guys just a little bit of what I do for the day, and yeah, keep watching.
Yeah, it's that new area over there. By T West, you know, instead of going to your left, we go through the...
Alright guys, we are in the MedRec office. This is Zuri here. That's my baby. So when I came here for APPEs, she was here. Look. This is what I have to go through. I'm gonna show you this. Yeah, it's definitely cracked. This is Alea, our other student here. Yes. Hello. What school do you go to?
Midwestern.
It's wearing your ass out, ain't it?
Yeah.
Okay, babe.
She said that seriously.
For a second.
So, as I stated before, for MedRec, we work the patient up in the morning. That's what they're doing right now, working the patient up in the morning. We'll get all this information, and then they will go downstairs to the first floor, second floor, third floor, and do interviews with the patient again about what medications are they taking at home. So, this is the office. A little ratchet. Real chill. Nothing crazy. Okay guys, we're in the IV room. That's Jada.
And I cut myself.
Jada's very upset today at everything under the sun.
It don't look like it, but I am.
She hates it here. Remember I was telling you guys that sometimes it's good, sometimes it's bad. It's one of those.
It's so bad.
one of those.
It's bad.
So I was going to show you guys some IVs, but Jada did it all. But that's okay.
I have one more. I can make.
Let's see you do the work. Not me as the future pharmacist. Let's see.
Exactly.
Let's see Jada do the work.
She's gonna be supervising.
But again, like I said, today's my last day, so this is my last time with Jada. I'm gonna miss you. So this is the section where you have to garb up. So garbing up would mean the gloves, the face mask, put the little booties on for your shoes. This is the line that you cross, and when you cross this line going in, you will have to be garbed up. This is the IV room that I'm not gonna go in right now. So that concludes a day in the life as a pharmacy student on her APPE rotations, doing institutional work stuff. Every rotation I make friends because that's just the loving person that I am, and I love it. I feel like I have friends like all over the place, but that's good. You make connections, you network, you never know. So I'm gonna go ahead and close out this video. Stay tuned for the rest of the videos to learn more about what a pharmacy, not even a pharmacy student, okay? Let's speak this into existence. I'm about to be a pharmacist. So, all the things that a pharmacist can do. I love you guys. Thank you for always watching. You're tuning in. Love ya.